If you've ever felt it, you know exactly what it is. It's not pain. It's not a cramp. It's something harder to describe than either of those things. A crawling sensation deep inside your leg, sometimes a pulling, sometimes a buzzing or an electric feeling, like something alive is moving beneath the skin. An urge, not a choice. Urge to move your legs that becomes impossible to resist the moment you try to stay still. And the cruel part, the moment you move, it eases. The moment you stop, it comes right back. For millions of people over 60, this feeling arrives every single night just as they're trying to sleep. It steals hours, it fragments rest. It leaves them exhausted in the morning and dreading bedtime again by evening. Most of them have never been told what it actually is, what it means, or what is genuinely driving it. Here is what I want you to know. That crawling feeling in your legs is not random. It is not simply part of getting older. And for many people, it is a signal, a warning that something specific and identifiable is happening inside the body. Something that, when found, can be addressed. Today, I'm going to show you 4 things that crawling feeling can be warning you about. The one that surprises people most, and the specific questions to ask at your next appointment that could change everything about your nights. I want to tell you about a patient I'll call Helen. She was 66 years old. She had been dealing with that restless, crawling sensation in her legs at night for about 3 years. Some nights it was manageable. Others kept her awake for hours. She had discovered that an over-the-counter sleep aid helped her fall asleep despite the sensation. So she started taking 1 tablet every night before bed, a common antihistamine sleep medication, the kind you can find in any pharmacy without a prescription. And over the following months, her symptoms got worse. She assumed it was the condition progressing. She didn't know, and nobody had told her, that the medication she was taking every night to manage, the problem was one of the most well-documented triggers for making that exact problem significantly worse. When we looked at her full picture, we found 2 things. The sleep aid was actively worsening her symptoms, and a specific iron marker in her blood, one that had never been tested, was low enough to be directly contributing to the underlying cause. Addressing both of those things changed her nights. Not immediately, but meaningfully within weeks. Stay with me, because Helen's situation contains 2 of the most important things I want to show you today, and both may apply to you. Before anything else, I want to make sure we are talking about the same experience, because the sensation we're describing is completely different from a leg cramp, and treating it the same way produces no result at all. A leg cramp is a sudden, hard, painful muscular contraction. The muscle locks. You grab it and wait. What we're talking about today has specific characteristics. First, an uncomfortable sensation deep inside the leg, described by patients as crawling, creeping, pulling, burning, itching, buzzing, or electric. Rarely as sharp pain. Second, the sensation begins or gets significantly worse when you are at rest, sitting, lying down, trying to sleep. Third, moving, walking, pacing, stretching provides relief, sometimes partial, sometimes complete. But the relief is temporary, and the sensation returns when you stop. Fourth, it is worst in the evening and at night, almost never present in the morning. If those four things describe what you experience, what you have has a name: restless leg syndrome. And while the name makes it sound minor, the research treats it as a neurological condition with identifiable causes, known triggers, and in cases, Kamaiji, meaningful treatment options. Here is what most people and many doctors don't explain about it. In a significant number of cases, restless leg syndrome is not a standalone condition. It is a symptom, a signal from the body that something else is happening. And identifying what that something else is, that is where the answers are. There are four things restless leg syndrome can be warning you about. Let me take them one at a time. The first and the most important: iron deficiency in the brain, not in your blood, in your brain. This is where most people's medical care falls significantly short. Your brain needs iron to produce dopamine. Dopamine is the chemical messenger your nervous system uses to regulate movement, and specifically to send the signals that tell your legs to stay quiet and still at night. When the brain's dopamine system doesn't have enough iron to function correctly, those signals become unreliable, faulty, and the result is the crawling, irresistible urge to move. But here's the part that changes everything. Your blood iron levels can look completely normal on a standard test while your brain is still iron deficient. Researchers have found that people with restless legs syndrome have significantly lower iron stores in their cerebrospinal fluid, the fluid surrounding the brain, compared to people without the condition, even when their standard blood tests come back in a normal range. Your blood and your brain maintain iron levels separately, and the blood can be adequately supplied while the brain is running short. The blood test your doctor typically orders, serum iron, does not reveal your brain iron status. The test that most closely reflects your body's stored iron reserves is called ferritin. And published research suggests that for people with restless legs syndrome, a ferritin level below 75 nanograms per milliliter may be contributing to the problem, even though many labs would consider that level acceptable. Up to 60% of iron-related restless legs cases occur before any anemia shows on a standard blood count. That means people are told their blood work is normal. The contributing factor is never found, not because it isn't there, but because the right test was never ordered. Helen's ferritin came back at 38. Her standard blood tests had been normal for 3 years. The second warning your restless legs may be sending you is one that most people never expect to hear, and it involves an organ that has nothing to do with your legs at all. Published research has established a strong and well-documented association between restless legs syndrome and chronic kidney disease. Among people receiving dialysis for kidney disease, the prevalence of restless leg syndrome is dramatically higher than in the general population. Studies report rates between 20 and 65% in dialysis patients, compared to approximately 5 to 15% in the general population. The mechanism appears to involve a combination of impaired iron metabolism, accumulation of waste products the kidneys can no longer filter efficiently, and disruption of the dopamine system. I am not saying that restless legs syndrome means you have kidney disease. Most people with restless legs do not. But if your kidney function has not been checked recently, specifically your creatinine level and estimated glomerular filtration rate, which your doctor may call EGFR, that is a reasonable test to ask about. Because if kidney function is compromised and that is contributing to your symptoms, changes the entire approach to managing what you're experiencing. The third warning may be the most frustrating one to hear because it means that something you have already been taking, possibly something you take specifically to help your sleep, may be directly worsening the condition that is disrupting your sleep. Antihistamines, specifically the older, sedating type, are among the most consistently documented triggers for worsening restless leg syndrome. These medications work by blocking histamine receptors in the brain. And in doing so, they interfere with the dopamine pathways that regulate leg movement and stillness. The specific antihistamine most commonly involved is diphenhydramine. It is the active ingredient in some of the most widely used over-the-counter sleep aids, including products with names like Zezquil, Benadryl, Tylenol PM, and certain formulations of Unisum. These are medications that many people take specifically because their restless legs are disrupting their sleep. They take a medication for sleep. The medication worsens the condition disrupting their sleep. The condition gets worse. They take more medication. That was Helen. 3 years of escalating symptoms with a contributing trigger sitting in her medicine cabinet the entire time. Antidepressants, specifically SSRIs and SNRIs, among the most commonly prescribed medications for adults over 60, have also been identified in clinical guidelines as medications that may worsen restless leg syndrome in many patients. The Mayo Clinic's updated management guidelines note that most antidepressants may be associated with initiating or worsening RLS. One exception appears to be bupropion, which has a different mechanism and may have a neutral or even helpful profile. Please do not stop any medication without speaking to your doctor. But if you take a sedating antihistamine sleep aid regularly and experience restless leg syndrome, bring that specific combination up at your next appointment. It may be the most productive conversation you've had about this condition. And the fourth possibility, the one your doctor may arrive at after the first 3 have been properly considered, is what the medical literature calls idiopathic restless legs syndrome, a primary neurological condition with no single correctable trigger. In these cases, primary disruption in the dopamine system is the underlying driver, and treatment options that directly address that pathway exist and can be discussed with your doctor. But here is the critical point. Reaching that conversation meaningfully only happens after iron has been properly assessed, kidney function checked, and worsening medications reviewed. Because treating a dopamine system in someone whose actual issue is low ferritin or a medication interaction or early kidney disease is treating the wrong problem. That is precisely why so many people with restless leg syndrome spend years managing symptoms without getting better. Here is what I want you to bring to your next appointment. First, ask specifically for a ferritin level. Not just a standard iron panel, ferritin, by name. Ask for the number, not just whether it's in the normal range. If it is below 75 nanograms per milliliter, That is a conversation worth having with your doctor about whether low iron stores may be contributing to your symptoms. Second, if your kidney function hasn't been checked in the last year, ask for creatinine and EGFR, a simple blood draw. Third, write down every medication you take, prescription and over the counter. Check the ingredient list of any sleep aid or allergy medication for the word diphenhydramine. Bring that list and ask your doctor directly. Could anything on this list be worsening my leg symptoms at night? Those 3 questions, in that order, are the most productive starting point for a condition that most people spend years managing in the dark. Let me close with something I want to say directly to you. Restless legs syndrome disrupts sleep in a way that is genuinely difficult to explain to someone who hasn't lived with it. It isn't pain in the way we normally understand pain. It's a compulsion that overrides your exhaustion. You lie there tired beyond words, and your legs refuse to let you rest. That experience deserves to be taken seriously. Deserves a proper evaluation, not a reassurance that it's part of getting older. Helen had 3 years of worsening symptoms before anyone looked at her Ferritin or connected her sleep aid to what was happening in her legs. 3 years of disrupted sleep, dismissed as aging. If you've been living with this and haven't gotten a satisfying answer, I want you to hear this clearly. The answer may be closer than you think. It may be a single blood test away, or a conversation about what's in your medicine cabinet. You deserve to sleep through the night. Now you have the language to start looking for the real reason you haven't been. Drop a comment and tell me how long you've been dealing with this sensation. I read every single response, and your answers help me understand what to make for you next. If someone you know is losing hours of sleep to this every night without knowing why, please share this video with them. It may be the first time anyone has explained to them what's actually happening. Before you go, we've now covered 4 videos in this series. The nerve signal causing your 3 a.m. cramps, what blood pressure medications may be doing to your leg nerves over time, why your legs swell every afternoon, and today, what the crawling sensation in your legs is warning you about. In all 4 of these videos, there is something that connects every condition we've discussed. Every one of them. The cramps, the nerve symptoms, the swelling, the restless legs is made measurably worse by chronic, low-grade inflammation. And one of the most powerful and underappreciated drivers of that inflammation in the body after 60 is the gut. Next week, I'm going to show you the research on how your gut microbiome, the bacteria living in your digestive system, directly influences the nerve health, inflammation levels, and symptoms severity in your legs. What changes in your gut after 60 that your legs feel the consequences of? And what the published science suggests you can do about it through what you eat. Subscribe, because the gut-leg connection is one of the most underreported stories in senior leg health. And it may explain something about your symptoms that nothing else in this series has.